Hi Venus, I'm back here with local anesthesia part 2. Okay, so before going into the topic, even if it is not a live class, the most common things that I have encountered in the last 1 week in the phone calls and as well as in the messages is these two things. Okay, so always pointing someone or some X apart from you for your failure. Okay, last year I was not successful, I did not clear my exam, the reason was this. Okay, now I'm not able to do, the reason was this. Okay, so I'm not going to talk about the X person. The person can be anything, sometimes can be your good friend, sometimes can be your parents or your family members, because I have seen many such cases where the main issue what you are pointing is just my parents are not allowing me to read, they are not giving me the permission, they are not giving me the scope. Okay, so XYZ. So what my suggestion for all of you is, whatever it may be, okay, whether you are with the best rank on the day of result or with the worst rank on the day of result, the person who is going to get 100% credit is you. Okay, if you feel that your parents or your best friend or some good persons in your circle who has spoiled your preparation, means it is you that is behind the particular individual. For example, if parents are not allowing you to study, they're not allowing you to do MDS, they're not happy with your preparation. Okay, means that is you have to take a move to explain your parents or to explain the particular person that how important is the preparation for you. Okay, how important is this exam for you professionally, so that you will get into good college, or I may get into good college, I'll be like this, the stipends will be like this, or the fees will be like this. If I get a free seat, these are the consequences that I am going to have, and these are the benefits that we are going to have professionally and financially. So it's you that have to explain everything to your parents. Okay, because I feel like only 5% or like 1 to 2% of the parents know what is really happening in dentistry, what is the scope of dentistry. Rest, most of us, like 97 to 98% of parents, they don't know what is the scope and what is the liability of dentistry. They just know that dentistry, okay, he treats the teeth, or he's called as a dental doctor. That most of our parents, they don't know even the branches or even the subjects that are present in the dentistry. Okay, it's you that you have to take some time, explain the parents about the consequences, and explain the parents about the upcoming future in the dentistry, so that the person who is going to stop you or prevent you from successful is going to understand like what is really happening here. Okay, so the main characters in the preparation, according to me, it's always you. You are the only character, whether you're successful, you're the only character, whether you're failure. So that is the first note. I want to make it very very clear. Don't throw the reason or your failure on someone. Okay, it may be him, but it's always you behind them who are the primary reasons. Okay, so the second factor that I'm going to discuss today is the fear factor. Okay, I think today morning I got a call, okay, from the old student who is repeating the examination. It's not the first call. I used to get regular text messages from the old students and people who has this fear factor. Okay, fear factor is the primary reason for most of us, like fear of failure. Like, why we study for the university exams, most of us, we study for the university exams, including me. Last 1 month, last 10 days, last 1 day, last overnight, I used to do hell of the work, because it's not that I want to be the university topper, it's not that I want to be the topper or a distinction candidate holder. It's always the main factor is fear of failure. I have a fear of failure, and I take that as a primary concern. I do this. And similarly, I'm not talking about the people who has had to start the preparation or who are nowhere bothered about the preparation. They don't worry about fear of failure, because NEET exam is not mandatory exam. If you want to get updated to the next level, This is one of the option, and this is the best way of option. But university exams which you give at the end of the year are mandatory, and if you fail, you will be separated from your batchmates, right? You will be separated from your respective batchmates, and that separation is the main reason of fear of failure, and that is the primary etiology why most of us, like 90% of us, read. I'm not talking about the 10% of distinction candidates or the people who read from day one or called as university toppers or college toppers, but I'm bothered about this 90% of the people in which I am included. I have that fear of failure, that if I fail in this exam, I'll be in the same year. My batchmates are going to get promoted. So that fear of failure made me to study for the university exams. But it doesn't happen with me or with most of us in the NEET entrance or any sort of PG entrance exam. Okay, so if you have this fear of failure, this fear is your driving force, because there should be some fear to drive you through the preparation. Okay, so fear should be there, because fear will drive you into the preparation, will force you to work hard in the preparation. But how to overcome and manage the fear, like there are few people who are psychologically feeling ill at the end of the day, that whether I'm up to this mark or not, whether I can achieve this or not. So always there is a one saying of always, when you're with MDS Conquer, always think positive. Okay, so universe is surrounded by lots of molecules. If you think positive, the positive will happen. Whatever you say, it's going to happen. If you say good, good will happen. If you say bad, bad will happen. So taking these words into consideration, don't ever talk bad about your preparation or about yourself. Let's talk good, because good is going to happen definitely, for sure. Okay, so taking these two important notes into consideration, this video, I'm just going to move further into local anesthesia part 2. Okay, so I have already discussed about the classification, the basic pharmacology classification, which has divided into esters and amides. So esters again divided into benzenoic acid and parabenzenoic acid. You can identify parabenzenoic acid with pro, and only ester which has two eyes is this. Rest all esters will have only one eye. Coming to amides, easy way to identify is amides always will have two eyes. You can see all the amides will have two eyes. So that's all. I'm moving ahead. Okay, yesterday I was discussing some stuff related to the medical emergencies, where I have given few hints that endotracheal route is the most fastest route of activation, right? So the next comes is the if you see this, the time to reach the peak values in the blood level will be 1 minute for intravenous, okay, and 5 minutes approximately for topical, and 5 to 10 minutes for intramuscular, and subcutaneous is 30 to 90 minutes. Okay, please do make a note about the angle of insertion of the injection for all this, okay, which was asked in 2017 question, and which was done in day before yesterday's class, right? Done. I'm just moving ahead. Okay, so what happens? We are done with the site of injection. That site can be any of the modes like IV or anything, but finally the product reaches the blood. From blood, it's going to distribute to all the areas. So there is two aspects of getting equilibrium. One is the slow equilibrium, and second one is the rapid equilibrium. Okay, so rapid equilibrium is mainly within the brain, heart, that is myocardium, lungs and liver, whereas the slow equilibrium is in the fat and the muscles. Okay, so do make a note that which equilibrium everything, right? So what is slow comes which, and where the rapid equilibrium is going to come. So I was talking like we need to talk about a few things about the half-lives, right? Half-life, I hope you know the basic definition of half-life. Half-life is the amount of time required to decrease the product of 100 molecules to 50, half of it. Okay, so most of your questions will move around the highest and the lowest. So already discussed, the lowest is chloroprocaine and procaine, whose the lowest values, and that's the reason why chloroprocaine is most commonly used in children. Easy to remember, it starts with C and it starts with C, right? And the maximum I have already discussed, that is the bupivacaine. Bupivacaine is the maximum with 3.5. 3.5 hours of half-life. Okay, so apart from this, the most commonly used by us in the market right now is lidocaine. So to make a note about lidocaine values, and lidocaine is almost the same as prilocaine. Okay, so most of the values, they move around 1.6 to 1 point, and you can remember all these values, right? 1.6 to 1.9, and the lowest and highest are mandatory. Okay, sometimes they can give half-life based questions by giving the value. For example, the half-life of a particular drug is this. They can give you the chloroprocaine has a half-life of 0.1 hour, that is 6 minutes, right? 0.1 hour, 6 minutes. They can mention the half-life value. In sometimes they will not mention the half-life value. You have to remember the half-life value, and you have to solve the problems, and all these problems will be a part of your general pharmacology. Okay, don't worry about them, we're going to discuss them in detail on the group, but make a note. But the half-life value of highest and lowest is important. Apart from that, it is mandatory that you have to learn 1, 2, 3 and 4 for the sake of exam. Done. So I'm done with the half-lives. I'm moving ahead. So this is basically application based questions, right? Application based question, condition, which LA to be given, which LA to be avoided, and everything. So first of all, I'm going to discuss, like as already discussed, the contraindications can be categorized into two types. Absolute contraindication means you should never try. Relative, you can try with some sort of abnormality and some sort of risk. So the two absolute contraindications are the 1 and 2. That is, allergy is always an absolute contraindication. You can see local anesthetic allergy was documented. Nowadays, documentation will be on your like case sheet, but previously we used to have some tattoos. You can see those tattoos pictures on in your malamet, or they're going to give a bracelet on which they are going to write about the allergies. Okay, they're going to write about the allergies, or they're going to keep a tattoo on the body telling that this patient is allergic to this. Okay, nowadays we have the documentation, so any sort of question can be given to you, but make a note. Okay, if there is a clear-cut documentation that the patient is allergic or the patient is having bisulfate allergic, make sure it is absolute contraindication. Okay, so absolute contraindication, right? So the next important point, so if the patient is allergic, then all the local anesthetics in the same class. For example, if the patient is allergic to esters, then you can try amides. If the patient is allergic to amides, then you can try esters, right? You can try the other class. The solution is you can try the other class. Second one is bisulfate allergy. Okay, bisulfate allergy is mainly an ingredient that is present in the vasoconstrictor, that is present in the local anesthetics containing vasoconstrictor. So it is mostly related to the vasoconstrictor. So you go with LS without vasoconstrictor. That is a solution. So next part is the relative contraindications. These are the abnormalities or the pathophysiologies that are present in the body. Okay, the first one is atypical plasma cholinesterase. Already discussed that esters are going to get metabolized in the plasma, right? Whereas your amides are going to get metabolized in the form of liver, right? So plasma, it is metabolized by an enzyme called as plasma cholinesterase. So whenever you have an abnormality with the plasma cholinesterase, it is better to avoid esters, right? It's better to avoid esters. Then what we have to do? Better to go with the leftover class, that is amides, right? So the next one I'm going to talk about is methemoglobinemia, or idiopathic or congenital, any sort of methemoglobinemia. As already discussed, it is mainly concerned with prilocaine. Okay, it's mainly concerned with prilocaine. So you can go with prilocaine, and articaine are also concerned with this abnormality. So you can go with other LAs. Okay, the next one is liver dysfunction or liver diseases. Okay, ASA. I hope you had a note about ASA. ASA classes, class 1, class 2, class 3, class 4, class 5, class 6. What does it mean, and what does it reflects is again a most commonly asked question, which we'll be dealing in the further classes. But make a note, if you have a liver problem, then as I already discussed that the amides are going to get breakdown in the liver, so amides should be avoided. Then you have to go for the esters. If you have a renal problem, okay, renal problem is a condition where whatever it is, like whether it is metabolized in the plasma or whether it is metabolized in the liver, the final output will be the kidney to eliminate it, right? So if you have a renal problem, most of the local anesthetics are contraindicated, and if it is mandatory that you have to go further uses of local anesthesia, then you need to plan some dialysis or anything to the patient to remove the remnants of LA. So next goes is the cardiac problem, and I hope you are very familiar with this. Like whenever you have hypertensive patient, or whenever you have some cardiac problem patients, the most common thing that you need to contraindicate is high doses, high concentration of the vasoconstrictor. Then you need to go for either plain LA or with the low doses of vasoconstrictor. The same goes with hyperparathyroidism. Hyperthyroidism patients will have hypertension, and the same goes this, whether it can be thyrotoxicosis or anything, right? Make a note that local anesthesia vasoconstrictor is avoided, and you need to go for less level of vasoconstrictor. So these are the most commonly asked application based questions related to the contraindications of LA. Okay, so I'm going to move to the next one. I hope you're very familiar with this. What is EMLA? Okay, that's a full form. Make a note. And if you want the definition, make a note, because this is again a common thing for your dental materials too. Make a note, the melting point of this mixture is lower than the melting point of the individual components, and the most commonly used product is this one, that is 2.5% of lidocaine plus 2.5% of prilocaine is EMLA. Okay, the few other things that you have to make a note about EMLA, which will be discussed on the group, don't worry, I'll be sharing the pic with clear underlining, indications, contraindications, mode of action, many other things which are very very important. So before that, and as already discussed in the morning note, that there is one more classification which is based upon the biological site of action. So basing upon which LAs are categorized into class A, class B, C, and class D, right? So LAs A, which is going to act on the external receptor of the nerve membrane, whereas C, which is going to act on the internal receptor. Okay, C is receptor independent, and D is receptor independent and a combination of dependent. Okay, so most common thing apart from the definition of each class is the examples. Biotoxins comes under A, whereas your quaternary aminium compound analogs of lidocaine and scorpion venom comes under B, and the most important thing are the last two. I'll have to ask questions on the last two. That is, your benzocaine comes under C, and your clinically used LAs, most of your clinically used LAs will comes under the class D. So the questions are, most of the clinically used LAs comes under D. Lidocaine comes under D. Okay, quaternary ammonium compounds which looks like lidocaine comes under B. Okay, so biotoxins comes under A. So this biological site classification is again an important aspect that you have to make a note. So I already told there is one more classification which is based upon the duration of action, right? So in which LAs are divided into shorter duration, intermediate duration, long duration. Shorter duration is of 30 minutes, that is pulpal anesthesia is approximately 30 minutes. Intermediate duration is 60 minutes, and it is 90 minutes. Very simple to remember: 30, 60, and 90. Okay, so most of the questions will be very simple. You can see that shorter duration is mostly without any vasoconstrictor, right? Without any vasoconstrictor, and this bupivacaine is used in pulp revascularization. Okay, this 3% is a bupivacaine is used in the pulp revascularization, which is of shorter duration. And make a note that this is the most commonly asked question, right? So your 0.5% of bupivacaine is of longer duration of LA. Okay, no need of this, but try to focus on this and this, most commonly asked. Okay, we're done with this and moving ahead. Okay, there is something called as PK value. We have already discussed the PK values. The PK values are the maximum. Okay, the maximum for these two. Okay, so the procaine pros are the maximum. You can see all the pros. Okay, pro stands maximum with the PK value, and you make a note about the minimum value. Minimum value is benzocaine. Benzocaine belongs to class C. Biological site classification, benzocaine belongs to class C. So apart from this, just make a note, most of your values will move around 7.7 to 8.1. If you don't know the answer, and if they're asking the PK value of a particular thing, apart from the highest and the lowest, most of the values will move around 7.7 to 8.1. Just make a note. Don't learn everything. That's not smart preparation. Most of your questions will be on highest and the lowest. If not, they will ask lidocaine. If not, anything in the range of 7.7 to 8.1. Okay, I'm done with PK values. So next goes with this. Anatomy is very, very important because we have multiple number of questions on this in most of the examinations. It's very simple. I don't want to make it complicated, but just go through this. That's more than sufficient. It's all there in almost all the basic MCQ books. Okay, the first one is nerve fiber. Very easy. And which covers the nerve fiber is endoneurium. Okay, your endoneurium is the one which covers the nerve fiber. Okay, and a bundle of 500 to 1000 nerve fibers. Now the nerve fibers combined, they form fasciculae. The one which covers the fasciculae is the perineurium. Okay, you can see the perineurium here, perineurium covering the fasciculae, right? So the innermost layer, okay, in the perineurium, which is the cover of the fasciculae, the innermost layer is perilemma. Okay, don't get confused, this is completely out. The innermost layer is perilemma. Okay, next one is epineurium. Okay, epineurium is the alveolar connective tissue supporting the fasciculae and carrying the nerve vessels. And the last one is epineural sheet. This is the epineural sheet, and this is the connective tissue. You can see all the this everything, this here and everything. You have a connective tissue that is epineurium, and covering outermost one is epineural sheet, right? So I hope you're very clear. Please do make a note. This is very, very important. They can ask this, they can ask by giving this diagram directly from textbook by labeling, or they can directly give it the simple definition. So these factors which affects the LA action are very, very important. We are already done with PK value. We learned the highest, lowest, and the ranges from 7.7 to 7.8, and it helps in onset of the LA. Okay, so lower the PK value, more rapid onset is the LA. Don't go very deep. Lower is the PK value. If you have low PK value, the mode of onset will be very, very fast. The second one is the lipid solubility of LA. Okay, so lipid solubility of LA affects which factor? Anesthetic potency factor. Okay, so increased lipid solubility increases the potency. Okay, so I mean, if the lipid solubility is more, the potency of the LA will be more, right? Next one. The next one is the protein binding property. So protein, if it's have the ability to bind to the protein, the duration, it controls the duration. So increasing in the protein binding allows the anesthetic cation to be more firmly attached to the protein located at the receptor site. Thus the duration of the action increases. So it wants, or it holds for a longer duration of time. Whenever it holds, the availability of it will be more, and it will be for a longer duration of time. Okay, then the non-nervous tissue diffusibility, it's also depends upon the onset. Okay, it helps in onset. Increasing in the diffusibility decreases the onset. Like if it is able to diffuse into other tissues apart from the nerves, means it's going to go away. So the diffusibility means moving away is going to decrease the time of onset. Okay, next one is vasodilator action. So it helps in controlling the anesthetic potency as well as the drug. The greater the vasodilator action, increases the blood flow to the region. Okay, there will be more blood flow if the vasodilator action will be more. So and apart from that, it helps in whenever the drug, the main reason to compensate this, we give a vasoconstrictor to hold it for a longer duration of time. I hope most of the things are very interrelated. I have seen a decent number of questions on this particular area, so I have added it, right? So next comes is the anticonvulsant blood levels. Like one LA is overdoses, so there will be few consequences which I'm going to deal in the second slide, next slide. But make a note, these values are important. So anticonvulsant blood levels of local anesthetic. So the anticonvulsant level will be seen at this value, that is 0.5 to 4, and the pre-seizures and the symptoms can be seen at 4.5. This is very important. Whenever the value goes and hits above 7.5 mu gram per ml, the tonoclonic seizures will be seen. Okay, so please do make a note. Okay, these are the categories of sympathetomimetic amines, which are categorized into direct acting, indirect acting, and mixed acting. So recently there was a question that is given in the AIMS exam. Very simple. Which of the following is indirectly acting? You need to pick the option. So please do make a note, add to this notes, do practice this. There is high chances that you can encounter the same question. So as already discussed, the overdoses of LA, what is going to happen? What are the consequences? So the overdoses can be categorized into two types, that is a minimal to moderate doses. There will be some signs and some symptoms, and similar there will, whenever it hits moderate to high doses, then the complications will be more and more. Okay. So we'll just have a look. Like when it is minimal to moderate, the patient talkativeness of the patient, I mean, they may feel vomiting sensation, there will be sweating, elevated blood pressure, elevated heart rate, elevated respiratory rate, failure to follow the commands, right? This is important, and these are all signs. And coming to the symptoms, the symptoms is restlessness, nervousness, the metallic taste, visual disturbances, auditory disturbances, loss of consciousness, syncope, and everything. Okay, so but most important thing is moderate to high dosages, that is tonoclonic seizures. I have already discussed. There will be generalized CNS system depression. Okay, and there will be depressed blood pressure. I mean, these are the late complications, or the complications which are mainly concerned with high dosage of local anesthetic solution. Okay, so that's the, you need to make a note, because they can ask you some questions. Okay, so basing upon this limited knowledge, you can easily pick the right answer. Okay, so I'm just going to move to the next part, that is, you can see the bubble in the catalyst, right? So they can ask you the bubble size. Okay, size is just 1 to 2 millimeters, and the content, this is the nitrogen gas. Okay, nitrogen gas will be present in this. Okay, sometimes in the clinical scenario, you can see a condition where the stopper can be extruded, and I mean, that is basically when your cartridge, this particular cartridge is stored inside the fridge. Okay, sometimes regularly the size should be this 1 to 2 millimeters, and sometimes unfortunately you can identify the presence of a larger bubble. Okay, so the larger bubble may be due to the contamination. Okay, so whenever you see a larger bubble, it is mandatory that you have to return the cartridge. Okay, you should not use that particular cartridge. And I hope you remember the anti-rust, okay, anti-rust solution which is used in your operative dentistry, that is sodium nitrate, right? 2% sodium nitrate that has been, okay, that they contain is capable of releasing the metal ions, which can be related to the incidence of edema. So like to prevent this rusting process, few people they use this, and that leads to the complication of local anesthesia. So care should be taken, like before you start the procedure, when you're using cartridge, you should see the size of the bubble, because if the size of the bubble is more than that, then definitely you can predict some sort of contamination, because few people they store these local anesthetics in disinfectants like alcohols. So whenever you use an alcohol contaminated, see this point, the local anesthetic solution containing alcohol produces a uncomfortable burning sensation on injection, right? So all these things has to be taken into consideration, because they can give an application based question on this particular area. So it's already known, I think this is a 2 marks question for you in the final year, right? Burning sensation upon injection is mainly due to, I mean, it can be a normal response to the pH of the drug, means the pH of LA what you're using, maybe the pK value has some role. And the second one of the cartridge contains sterilizing solution like alcohol. I was discussing in the last slide that alcohol can be used for disinfection of these cartridges, sometimes contaminates the LA. Or sometimes the overheated cartridges can also cause a burning sensation, or cartridges which contains vasopressin can also cause this burning sensation. Make a note about these 4 points, which are the primary reasons for the burning sensation upon injection. Okay, so next one is the food and drug administration, lactation categories. This is very, very important. Previously asked in PGA, followed by names. Okay, and of course, there are high chances that they can repeat the same questions. So categories are the S category, S question mark, S star, and NS. NS is very simple, and S means not safe. And question part clearly says that you don't know anything. Okay, S is for the safety, very simple. S is safe for nutrient nursing infants, and medication are usually compatible with the breastfeeding. Whereas S question mark, you don't have proper literature, means you don't know, you don't have any idea. Whereas S star, potential for significant effects on nursing women, it's going to cause the damage, but the medication can be given with some caution. Not as means not at all safe. Okay, so categories of pregnancy drugs will be discussing in pharmacology, which is important thing because there are many questions which are asked on this in 2017 NEET. So there are different categories of drugs which are to be given in the pregnancy. We'll discuss in pharmacology, but now we'll be focusing more on the local anesthetics, which comes under these categories, and the lactation categories, right? So most of the local anesthetics, all the local anesthetics, they comes under B and C category. And what is most commonly used? Your lidocaine. So okay, lidocaine and prilocaine, they comes under B category, and rest all they comes under C category. Okay, next one, not safe. Okay, so in lactation time, epinephrine is not safe. Not safe. Okay, epinephrine is not safe. Which is only safest one? The safest one is lidocaine. So lidocaine, which comes under pregnancy B category, is the safest one. Okay, both for the lactation as well as for the pregnancy category. Okay, so please do make a note about these points, which were very, very important. So done for now. Signing off, Dr. Srikanth from Team MDS Conquer. The only extra thing that I'm going to cover in the part 3 will not be a video class, will be a class which will be taken on your respective groups. Okay, so we'll be dealing with a few things which are already discussed here. I'm just going to ask few questions, answer them. That is the first part in the part 3, and followed by the problem solving. Okay, I'm going to explain the problem solving stepwise. I hope you remember all those things. How much amount of local anesthesia is present in one cat race? How much amount of epinephrine is present in one cat race? How many cartridges can we give to this particular individual who is of 60 kgs? I hope you have encountered such questions in your UG life, either in your Viva or in your clinical scenario in the departments, because it's the most commonly asked Viva question. So such things are again most common for your NEET and AIMS and PGA and all other exams, including NBD, right? So such things will be discussed. The third part I'll be discussing on the group. And stay positive, stay blessed, and stay at home. All the best.